One of the things I still struggle with, and this is I always like to explain kind of what we're working on, is we use forward motion in terms of orthotics. I think it's an excellent orthotic, but I find forward motion has a lot more modifications and adjustments than Northwest, meaning the arch tends to hurt more, and I have to send them back a lot more than I ever did with Northwest. Now, they are maybe $30 cheaper, but there's a lot more adjustments. And so I feel much more confident, or like my partner, he does more Northwest. And so like they have a nice posterior tibial tendon dysfunction orthotic that worked really well for this patient. And there's less of a risk of them not feeling good. I think one of the concerns, depending on your orthotics, is if you're having a lot of returns or a lot of uncomfortable orthotics, it makes it a challenge. And so this is something that I've been struggling with forward motion because of the arch. I tend to always do the regular arch. I don't usually do a high arch unless it's a cavus foot, but I'm finding the materials are a little bit different versus like the carbon fiber one with Northwest. So I'm just kind of saying something that I'm struggling with, and I'm almost thinking about doing more of that carbon fiber because I tended to have a lot less returns. But it also could be just that I'm doing many more orthotics and I just have to get better. What I don't like is when they pick them up, because I don't see them when they pick them up, and then I would do a 6-week follow-up, but many times they come in and they're just frustrated because they're not comfortable. So I'm trying to be much more clear with patients. Hey, if these aren't comfortable, don't wait 6 weeks to tell me that. We need to kind of make an adjustment earlier, or I'm thinking about switching to another lab.